Hi, I'm Denise and I work with self-governance, and so we've decided to team up with Health to answer some of your questions.
My name is Christopher Hersack. I am the Director for Dakota Yate Lodge, and I am also Sioux Valley's Incident Response Commander. So thank you everyone for generating this list of questions, and we'll try our level best to answer them.
Okay, so Christopher, first question we have here. My concern is, I don't trust vaccines, let alone a new rushed, unproven one. What are the plans for the vaccine rollout for Sioux Valley, and what about the people that refuse? Will they be shunned and let go from their job?
Right, and so I think many of us recognize vaccine hesitancy in general, and certainly more specifically that of mRNA vaccines. But in truth, the vaccines themselves are highly effective. The main goal of a vaccine for a particular infectious agent is, or such as that of COVID-19 virus, is to teach the immune system what the virus looks like before it actually enters the body. So once educated, the immune system is able to foster a response to it. Now, there's a false belief that the vaccine will change the DNA of our cells, and that's certainly been adding to the vaccine hesitancy. But the truth is, none of the ingredients of the vaccines enter the nucleus of the cell where our DNA is actually kept.
Okay, well, that's good to know.
So messenger RNA is the molecule that's used to create proteins, or something that's called peptides. And when injected, it causes these proteins to be made. So this is how the vaccine works. Now, when these small pieces of protein exit the cell, this allows our body to pick up on them, and essentially this is how an immune response is fostered. Now, in my mind, vaccination is certainly a free choice. I don't think that anybody could or should be shunned for exercising free choice. But I also think it's important to have full informed consent. And the truth is, we know with certainty the virus has killed millions, and we can also conclude with certainty the immunization has killed none.
Oh, that makes a lot of sense. So our second question, why does Sioux Valley only recommend 10 days of isolation for COVID positive cases? Everywhere else they recommend 14 days of quarantine or isolation for both positive cases and contact cases.
Right. So if you test positive for COVID-19 with mild to moderate illness, it's a 10-day self-isolation period. And now, generally what we say is a quarantine period is not completed until 24 to 48 hours lapse, wherein an individual does not have symptoms. Now, if you've been in contact with somebody who has had COVID-19, the isolation period is 14 days from the last date in which you've had contact with that individual. So those two numbers are a little bit different. And even if you test negative for COVID-19, your isolation period still extends for the full 14 days as a contact. Now, the reason why we do this and why people must self-isolate for the full 14 days is because this is the incubation period of the virus, or how long it takes for the virus to start multiplication again.
Okay. Our next question, will banned employees be obligated to take the COVID-19 vaccine?
Right. So again, at present, all vaccination is a voluntary choice. I think there's ongoing discussion about what's called immunity passports, and certainly the Canadian government hasn't been partaking in those conversations, but that would basically be things like proving serology tests before getting on an airplane.
Okay.
So yeah, that's like really next level.
Really intense. No, that's good. Our next question is, are off-reserve band members going to be eligible for the vaccine? If so, do you have a time frame for when it will be available? Also, for those off-reserve band members, will their children, if not eligible for band membership, be eligible for that vaccine as well?
Right, so everyone in Canada will have access to the free COVID-19 vaccine, but the logistical concern is obviously timing. To date, the vaccine distribution to Sioux Valley Dakota Nation has been slow. We've received 240 doses or 24 vials to date. This equates into about 120 members being actively immunized. So back in December, an age stratified plan was submitted on behalf of the community, and this was given to FINEP. These numbers, to my understanding, did not include off-reserve members. However, Manitoba's COVID vaccination plan does list First Nation members as a priority within their population groupings. So it's inevitable, it'll be a matter of time for off-reserve members to receive. And these are likely to originate from the so-called super centers. As for children, at present there's no vaccine that's been approved for individuals under the age of 18. So we don't have that, ability to provide that immunization, and certainly we want to see some data before we begin to immunize children.
So what disciplinary actions are being taken for people who are not following COVID guidelines and restrictions, whether they're staying at an on-reserve member's house or just visiting?
Mm-hmm. So failure to follow public health orders in general have certainly resulted in security follow-up, and in the most severe of instances, fines.
And with the fine being, I think, something like $12.96 or something like
yeah,
that?
I believe that number rolls off the memory. I think if violations are witnessed, the best approach we can take at this point is to notify security, and those numbers are available on the website.
Okay. What will be done and what restrictions will be put in place for people trying to stay at an on-reserve member's house?
Right, so under our current lockdown state, really visitation should be curbed as much as comfortably can be done. I think that now the weather is turning a little bit nicer. It might be the time to take those visitations outside, still keeping them brief. The most recent announcement of the province is that we can have 2 individuals as dedicated visitation members of a household. I think that is reasonable.
Yeah, I think that's fair. That's pretty good. Who can I contact about my COVID questions and the vaccine if I am hard of hearing and unable to make a phone call? Is there anybody I could text?
Right. So there is print literature that's been sent to homes from Sioux Valley Dakota Nation Health regarding vaccine, and several information pamphlets to date. So I think further questions are certainly can be directed to either Helen at 204-216-1172 or Charles at 204-720-38888.
Our next question is, the new B117 variant, as they're calling it, is apparently in Manitoba. Is this variant detected using the same COVID testing procedures?
Right. So that's a really excellent question. And to be honest, variants of concern, such as those originating in the UK, South Africa, or Brazil, continue to spread globally. So the B117 was first detected in Canada back in December of 2020, and most recently within the last few weeks of Manitoba. So our main goal within our province is to slow the introduction of these variants. So we know that it's inevitable, but the more people we can get vaccinated in time, the more lives that will potentially be saved. So to address the second part of the question, the samples are sent to our provincial lab so that we can get the variants detected. And the technology that's used at that time is called a polymerase chain reaction. So it's a type of test wherein they multiply the genetic material many, many times and basically grow the virus very rapidly. So this is a very similar test compared to what all labs are using right now, the so-called PCR test. The truth is, though, this initial screening searches for a particular genetic mutation, And for academic purpose, it's the N51Y. And that's a gene mutation that happens. And basically that is the gene mutation in which all the variants of concern are demonstrating at this point.
Oh, okay, so that's where you have to find that one first, and then based on there you find out where it branches off.
Yes.
Wow, oh, that's fantastic. So because of this, are double masks going to be the standard now that this variant is making the rounds?
Yeah, and that's another really great question, and I think it's really too early to make this recommendation. And the study where this originated, it was based on a mannequin, and they saw a reduction, and the numbers kind of escape me, but I want to say 96.1% reduction of droplet contact for both the mannequin and of course, the sample on the other side. But the truth is, limiting your physical contacts, maintaining hand hygiene, practicing cough sneeze etiquette is certainly as effective as double masking, if not more so. So I think, again, keeping our travel for only essential purposes is more advantageous than double masking at this point, but stay tuned.
To make sure, yeah, no, we will update you. So with that being said, what is the proper way to wear your mask, and what is the difference between a cloth mask and one of the blue medical ones? Will my cloth mask still be effective?
Right, and that's another really great question. And so good fitting masks in general are an excellent weapon to combat spread, but the truth is a proper mask, or those seen under the nose or below the chin, or worse yet, sitting on a desk and not being used, are not effective at all. So a well-fitting mask should be large enough to cover the bridge of your nose, tightly against your chin, obviously the mouth without gapping or draping. So it should fit securely to the head with either ear ties or ear loops. Ideally a mask that doesn't require a lot of adjustments, so you see a lot of people that are uncomfortable and they're constantly touching their mask. That's, lends to a risk of infection, so ideally a mask should be comfortable enough to be worn through the day with minimal touching. So yes, non-medical masks or homemade masks are fine, assuming they are at least double layered, so they should have 2 layers, and it should be a breathable material such as cotton. So I do know that I have seen a number of neoprene type designs out, and those are the ones where they may also have like a thick polyester lining, and people are breathing and it's being drawn into their oral cavity each time they're trying to take a breath, and it's just not all that practical, because again, they should be comfortable.
All right, so let's see. What do the different variants mean, and why are they more contagious?
Right, so the 3 variants that I had mentioned do seem to spread more easily, and certainly more quickly among people, and obviously causing more infections related to COVID-19. So to speak more specifically, the UK variant, or the so-called B117, has 23 mutations. Several of these mutations affect the S-like protein, and maybe we would be able to show a picture of that.
Yeah.
And the virus really uses these S proteins to attach themselves to the cell. So there's some speculation that this virus may be associated with an increased risk of death compared to the other variants. But certainly further research is needed at this point. The South African variant, or the so-called B117 has multiple mutations on the S protein as well. And lastly, the Brazilian variant, or the P1, has 17 mutations, including 3 on the S protein. So the best way to really conceptualize this is that they're stickier. So the stickier they are, the more effective they bind to the receptor site and enter into the cell.
So our next question is, I am a dialysis patient, and I'm wondering if it is safe for me to get the vaccine, and how would the vaccine affect my treatment?
Right, so there's no specific information about the safety of the vaccine in chronic kidney disease. However, the vaccine within the clinical trials have tested other individuals with other health conditions, such as diabetes, asthma, HIV. And the results of these studies have really indicated that the vaccine can be safely given to individuals who have these conditions. So we do know that patients on dialysis are at greater risk of severe complications of COVID-19 or for COVID-19. And the Pfizer and Moderna vaccines really do not involve giving a live virus to the body. So it's expected that it would be safe to be given to people with renal transplants or those people that are on immunosuppressants. But I think, the best advice is to check with your doctor to see if the vaccine is safe for you. So without knowing the specifics of the renal replacement program that the individual would be questioning, it's hard for me to, provide an appropriate answer.
I believe in traditional medicine and feel that the vaccine is rushed. How is it able to become available so quickly?
Right. And that's also another great question. And I don't think that vaccination in any way is intended to replace traditional medicine. Interestingly, in many communities, traditional healers and the knowledge keepers were identified as the first priority groups eligible for the COVID-19 vaccines. So now the speed of development really is a reflection of years of work. The scientific community learned a lot about coronaviruses, particularly with SARS and MERS. So if you remember severe acute respiratory distress syndrome, and then of course MERS, Middle Eastern respiratory syndrome.
H1N1.
Less so H1N1, a different virus, but certainly those coronaviruses. Much, again, was gleaned through those times. And really, this vaccine didn't come out of nowhere, and no scientific breakthrough stands alone. So there was a lot of footwork laid well before this.
Are there any side effects from taking the vaccine? Do we know anything about effects in the long term?
Right. So the best documented side effects of the Moderna vaccine really include pain at the injection site. Excuse me. Some people complained of feeling tired or lethargic. Myalgia or muscle pain would be another big one that was mentioned. Now, they were generally described as mild to moderate, so meaning that they didn't require any interventions to make them go away. They were generally self-limiting, so again, had a period of time in which they faded away. And certainly the Pfizer vaccine was similar. So unfortunately, there are no long-term studies available, but I can tell you, both anecdotally through experience and certainly, consistent with the peers that I have been immunized, the effects are more pronounced with the second dose of vaccine.
Okay. The next question here. Why does the vaccine have to be taken in 2 doses, and how much time are you supposed to have between each dose?
Right. So that's another great question, and it's really known that the immune response of 1 dose of the vaccine is relatively weak, and even though people who got their first dose had some protection against symptomatic COVID infection, it's really not known what will happen if people only get 1 dose. So by design, the development of the vaccine really required 2 injections. So I guess to go back to the question, there's really no evidence to suggest that individuals receiving 1 dose will have any type of long-term immunity, which is concerning. So to turn to the CDC, or Center for Disease Control, they recommend the second dose of COVID-19 vaccine be given within 3 weeks of the first dose for the Pfizer vaccine, and within 4 weeks of the first dose for the Moderna vaccine. And no more than 6 weeks should lapse between the 2 doses.
Okay. Which is, so, if you miss your second dose, does that mean the vaccine is ineffective?
Right. So again, no more than 6 weeks should lapse between first and second dose. Although there is some suggestion that if the second dose can be given within this time frame, it can be done so without having to start the series again. So in other words, you would receive it when it was available. Now, it's not recommended more so, or at least it's more documented, that it should not be given earlier. Although some exceptions exist wherein you can take it up to 4 days early compared to when you were to be receiving it. But stay tuned, I think, again, as Health Canada monitors the situation, we'll get a better understanding about how some of that stuff works.
If you get your second dose, but it's way later than recommended, how does that affect the vaccine? So like say you kind of miss that 6-week mark.
Right, so unfortunately we don't have that information readily available. The thought is, again, an individual that received one single dose would have some relative immunity.
So it would kind of kickstart the process.
Yeah, basically. So when we go back and think about how the vaccine really works, we give that introductory phase of the virus, the body, where the mRNA, the body starts to develop its immune response. The second time is basically fine-tuning that cascade of events.
Okay.
So that if we were to encounter it in the real-world setting, we would really have the foundation work in place to really make a significant response to it.
Okay, and so our next one, is there a reason Sioux Valley went with the Moderna vaccine over the Pfizer?
Right, so Sioux Valley did not have any input or specified preference with vaccines. This was federally directed. I know that the Pfizer vaccine does have some storage parameters which certainly would pose challenges, so those are the ones kept at extremely low temperatures, and it's not standard refrigeration equipment that would allow this to be stored. So Moderna logistically, to store it is much easier.
Okay, well that makes sense, that's good. So our next one, is it true the vaccine will have to be taken annually like a flu shot? Will you have to do another second dose if this is the case?
Right. So I can tell you the vaccine manufacturers are looking for booster shots, more so geared towards the variants of concern.
Okay. What about people who are allergic to things like the flu shot? Would this prevent them from being able to get the vaccine?
Right. So Moderna Therapeutics Incorporated, the name of, just to focus on Moderna for a moment, the company that manufactures the vaccine is legally obligated to provide any adverse reporting to Health Canada. And Health Canada has a mandate to inform us, the public, of these concerns. So the only real known allergic call that I'm familiar with is something across sensitivity to what's called polyethylene glycol, or PEG. And so if you were allergic to PEG, the vaccine would be contraindicated or not recommended for an individual with that due to, again, an ingredient concern. So there are other handful of non-medical ingredients, and I did record those. And those include acetic acid, cholesterol, what's called lipid SM102, sodium acetate, sucrose, tromethamine hydrochloride, and water for injection. So certainly if individuals had cross-sensitivity concerns to any of those constituents of the medication, I think that it would be important to self-identify and have that discussion if it would be wise. So certainly, much like a flu shot, if you were allergic to some of the ingredients, it would be, cause for discussion at minimum.
Okay, no, that's good to know. Our next question. So, how did Sioux Valley come to the decision to implement security checks and roadblocks when the rest of Manitoba has eased restrictions?
Right, so Sioux Valley has been monitoring infection patterns and really escalating our plans as required. So if we remember when we first went into a red lockdown, some of the provincial numbers were quite staggering, and transmission rates had almost exceeded 15% at that time. So from a surveillance stance, we really quickly shifted gears into a containment phase when we first recognized that community cases were popping up. And to be honest, the checkpoints helped us achieve rapid containment that was highly effective. And so when we look at some other communities that didn't deploy that form of public health measure, we see that their cases continue to linger on, and certainly we didn't wish to exercise that risk. So our next goal obviously is to achieve 2 incubation periods or 4 weeks with 0 net cases to ensure that we've eradicated the virus from community.
And so our next question, what are our rules for wanting to interact with another household? Can members from one household interact with another? And how many people can visit safely? So I remember this comes back to what we were saying before.
Very much so. So I think, again, keep interactions at a safe distance with appropriate PPE. I think, again, within our current lockdown state, visitation should be limited as much as conceivably possible. I think ideally keep those visits brief. If 2 designated people are going to be entering the household or entering one's bubble, I think it's important to ensure that all groups realize that the bubble is like a pact. So it's not something that should be broken or shared with others.
My sister doesn't have a vehicle, but I do. Is it against rules to help her and take her to town to shop?
Right. So I think in the best possible scenario, we would have a household member of your sister obtain groceries for the household itself. I think in the second best scenario is that one could shop for the sister, or alternatively, if your sister is considered part of your designated persons within your bubble, I think a ride can safely be provided under current public health orders. Truth is, though, it would still be advisable to make sure that you have PPE on when sharing that vehicle space.
So what is the difference between rapid testing and regular testing? Are there different levels of effectiveness? And why can't we all just use rapid testing instead of waiting days for results?
Right. So that's another excellent question. And truth be told, there's a variety of testing platforms available for SARS-CoV-2, so the actual virus that causes COVID. So the antigen test, or the rapid test as they say, detects protein fragments of the coronavirus, as opposed to the PCR test, which I mentioned earlier, so polymerase chain reaction, which actually detects genetic material. So genetic material that's very specific to the virus itself. So in truth, rapid tests are most accurate in people that are having symptoms. And at current, the best practice is people who do receive a positive rapid test still go on to get a confirmation swab done for a PCR test. So we can't exclude that form of criteria. And of course, it really lends to redundancy, so people are inclined not to get 2 swabs if they can just get 1.
No, that makes sense. And so our final question, I am a diabetic and I was wondering, is the vaccine safe for people like me? Have there been studies done with people who have pre-existing conditions?
Right. So again, the safety of the vaccine specific to individuals with diabetes, as well as asthma and HIV with certainty, has been demonstrated in clinical trials. So the answer is yes.
So you are safe.
Yes.
This is good to know. Thank you so much for answering our questions. And thank you guys for sending them in. This has been very helpful and very informative. And if there's anything else you would like to know, as always, shoot a message to Health. And we'll do the best we can to help everyone as best we can.
Thank you again, everyone.
Thank you so much.